No worries. Yes, they are. Hello, everyone, and welcome to our coronavirus press briefing on this Friday. Thank you for joining us. I'm Donna Bush. Of course, for those of you who've joined us via social media, the channel, or on Radio Cayman, we say a great thank you to you. We go first to a prayer from Pastor Michael Jeremiah.
Good afternoon. My name is Pastor Michael Jeremiah, pastor of the Calvary Baptist Church in Georgetown. The Bible tells us in Mark 11:24, therefore, what things soever ye desire, when ye pray, believe that you receive them, and you shall have them. Let us pray. Our Father and our God, today we thank you that we can call upon you. We can come to you in the name of Jesus Christ, the only one that has given us access to the very presence of God. And Lord, we come today on behalf of our leadership, our team here that's done a tremendous job in leading and guiding our nation, even in the midst of this crisis. I pray now, dear God, that as they deliberate and explain and share information with us, that you'd give them wisdom. Thank you so much again for protecting our nation so far from an outbreak of this pandemic. We pray you continue to lay your hand upon us. Give our leaders wisdom as they take us through this, dear Lord. And we pray that, God, you'd spare this nation. Help men to realize that in the midst of this crisis, this is an opportunity you have given to us to look up to you, to repent, to turn our hearts toward heaven. I pray for souls, dear God, that yet are unsaved, that need to trust Christ. May they realize that all of this is to point men to repentance. Thank you that your word says, whosoever shall call upon the name of the Lord shall be saved. Bless now and guide in this session today as we commit this to you. In Christ's name we pray. Amen.
And thank you, Pastor Jeremiah. Joining us in studio are the His Excellency the Governor, the Honourable Premier, and the Minister of Health, as well as the Chief Medical Officer, the Commissioner of Police, Director of HMCI. We also have our sign language interpreter joining us. On Zoom are members of the press and the Medical Officer of Health. We first go to Dr. Lee.
Good afternoon. Just an update on the testing that's going on in the sister islands. Dr. Velasamy has just texted me and advised me that 200 tests have been done on Little Cayman, and in Cayman Brac over 200. So about 245 have been done in testing, and their frontline testing has included not only, well, clearly all of the population of Little Cayman, but on Cayman Brac it's been included the nursing home, the police, the fire service, and so on. We have a positive result to report today, and this positive result is one that's been acquired in the community. So I think it's really important to remember that this can pop up anywhere. These are ordinary people going around their everyday business, and they just do not know how they've become positive. So we do have this positive case. That reminds us to please keep your distance from people, wear masks when you're in public spaces, wash your hands, as we all know the advice, but please keep to that. And the social distancing when you're exercising as well. I've mentioned before, I've seen a lot of sports people together. I understand the desire to be together, but please, if you can remember that this is to protect everybody, not just yourself, but everybody on Cayman from catching COVID. The other results are that there are 391 negative results to report, bringing the total tested on all of the islands to 1,927. I'm just breaking up the screening tests a little bit for you. This is to give you a little bit more information. So far, we've screened a total of 949 people across the islands, of which 772 were done at the Health Services Authority and 177 were done at the Doctors Hospital. Of these 949, we have 11 positives, and we know that 4 of those were returning students from the United Kingdom. So our totals at the minute are that we have 74 positive, the number of symptomatic are 32, the number of asymptomatic are 28. We have only 3 admitted, so the number at the HSA has dropped. There are only a total of 3, and we know that 2 of those at the Health City are currently admitted for other reasons. 10 have recovered. Thank you, Donna.
Thank you very much, Dr. Lee. We're now going to call on the Commissioner of Police, and he will give us an update, and then we'll go back to Dr. Lee with any questions from the media.
Good afternoon. Just an opening comment. Since last week, the crime situation remains very stable. The hard curfew continues to operate very well. And today what I'd like to do is deal with the new hard curfew order number 4, which came into effect at 5 a.m. this morning, and maybe explain a little bit about it and go through the conditions. So yesterday, the 30th of April 2020, as required under the provisions of Section 49 of the Police Law 2017 revision, I consulted with His Excellency the Governor of the Cayman Islands, and I advised him of the necessity to impose a new curfew order effective 5 a.m. this morning, the 1st of May 2020. My advice was predicated on the basis that it appears to me that, having regard to the immediate threat of a serious hazard throughout the Cayman Islands associated with the COVID-19 pandemic, that there are reasonable grounds to believe that in the interests of public safety it is necessary to impose a new curfew order. I have now received permission from His Excellency the Governor to impose a curfew order effective this morning, Friday the 1st of May 2020, commencing at 5 a.m. and concluding on Friday morning the 15th of May 2020 at 5 a.m. In effect, this imposition of curfew order will be in place for 14 days from today, the 1st of May, between the hours of 5 a.m. and 5 a.m. and will be subject to the following conditions. Soft curfew or shelter-in-place regulations will be in operation between the hours of 5 a.m. and 7 p.m. today, Friday, and tomorrow, Saturday. Next Monday, the 4th of May 2020, this will change and the soft curfew will be extended by 1 hour, which will be between the hours of 5 a.m. and 8 p.m. daily, Monday to Saturday. So from next Monday, there's an extra hour, 5 a.m. to 8 p.m., and that runs Monday to Saturday. The hard curfew or full lockdown, save for exempted essential services personnel, will be in operation this coming weekend, that is tonight, Friday, and tomorrow night, Saturday, between the hours of 7 p.m. and 5 a.m. Next week, effective Monday, the 4th of May 2020, this will change, reducing by 1 hour with hard curfew each night between the hours of 8 p.m. and 5 a.m. Exercise periods not exceeding 90 minutes will be permitted between the hours of 5:15 a.m. and 6:45 p.m. today, Friday, and tomorrow, Saturday. Next Monday, the 4th of May 2020, the 90-minute exercise period will be permitted between the hours of 5:15 a.m. and 7 p.m. Monday to Saturday. No exercise periods are permitted on Sunday during the period of hard curfew. On Sunday the 3rd of May and on Sunday the 10th of May 2020, we will operate a 24-hour curfew order with full hard lockdown on both dates. No person or persons other than exempted essential services personnel will be permitted to leave their homes on those dates for any reason. Exercise periods in public places is not permitted on either of those two dates. And if I could just turn now to beach access, and appreciating all the difficulties this does cause, to set out the terms of the order from Friday the 1st of May 2020 through to Friday the 15th of May 2020, there is a full 24-hour curfew or hard lockdown of all public beaches throughout the Cayman Islands. This means no access to public beaches throughout the Cayman Islands at any time during the period 5 a.m. on Friday the 1st of May this morning and 5 a.m. on Friday morning the 15th of May 2020. And for clarity, this in effect is a full hard lockdown of all public beaches throughout the Cayman Islands, which prohibits any person or persons from entering on, walking, swimming, snorkeling, fishing, exercising, or engaging in any type of marine activity on any public beach throughout the Cayman Islands. This hard curfew runs through until Friday morning, the 15th of May at 5 a.m. And if I could take the opportunity to remind all the listening public that a breach of the hard curfew order is a criminal offence carrying a penalty of 3,000 Cayman dollars and imprisonment for 1 year, or indeed both. Thank you.
Commissioner Byrne, thank you very much for that update. We're now going to call back on Dr. Lee for answers to questions And we're going to go first to Ralph from the Caymanian Times.
Good afternoon, Dr. Lee, and thank you for your report. Could you please repeat the numbers for me, just the major ones, such as the number of tests and the number of positive cases, please?
Yes, 302 tests in total with 1 positive.
Okay, and total number of tests?
1,927.
Okay, very good. Thank you very much. I have two other short questions for you. Can you give an update on the backlog of testing for the quarantine facilities?
I didn't quite follow the question. I'm sorry.
Can you give an update on the testing for the Can you give an update on the backlog on removing the backlog of testing at the quarantine facilities? In your last one report, you said there was a backlog of testing those people who are quarantined.
I think that was now complete as of a few days ago.
So they're now up to date. Thank you. And the second question is, then isolation protocol for Cayman Airways pilots. We know they're doing repatriation flights, and we want to make sure that they're safe. Is there an isolation protocol when they come home?
No, they're not being isolated because they're going to countries where they are not leaving the aircraft. So the crew and the pilots are staying on board the aircraft, and they're not interacting with anybody on the ground. If they do interact with anybody on the ground, if they're required to do so, then yes, they would need to go into isolation. So we've been through the protocols for that. So a lot of the people that are coming in are actually being brought in by American crews who, again, do not leave the plane. They stay there and they go off again, like the cargo planes and so on. But I've said Cayman Airways understands the general principles behind this, and we've gone through the detailed plans with them. Additionally to that, when they're bringing, if they're, for example, going to pick up a bunch of people from another country, they are making sure that the distancing within the plane is very well spaced, that the crew, unless there's an emergency, obviously that would change everything, but provided there's no emergency, the crew are not interacting at all. Water bottles are being left on the seat. There'll be no service through the flight. And all the crew have been sent to, or either have been or will be going to the HSA to be taught on the correct use of personal protective equipment in order to safeguard them from any potential infection.
Okay, thank you very much.
Dr. Lee, just to confirm that is it 392 results or 302?
392.
Okay, thank you very much. Okay, we're going to go now to Shanda from Radio Cayman.
Thank you, Donna. Good afternoon to each and every one of you. Dr. Lee, just want to get your thoughts on just a couple of things here. The long-term outlook. Not sure if this was addressed before, but let's say 1 month from now, 6 months from now, for our recovered patients, or after someone recovers from the virus, how often will they be retested or should be retested, if at all, and on what grounds?
Once people have had a positive test, they're then retested 14 days after their positive test. And if they've had 2 negative tests after that 14 days, they're then released and they're not retested. They're considered good to go.
Good to go. All right. And again, on the same line of long-term outlook, I know it may be too soon to tell or determine based on time, data, and even knowledge of this new virus, but are you concerned with the potential of long-term virus complications? Like what sort of plans are in place, or do you may have in mind to ensure that recovered patients or those diagnosed with COVID-19 are not at risk for long-term complications?
I'm not aware of any series that have looked at longer-term complaints that people have suffered. That will clearly, as you've suggested, that'll come out with time. It may well be that there are some longer-term sequelae. That would become an issue for whoever is the physician that's looking after their patient. But I have not yet seen any evidence for that, but it's clearly it will be an interesting, well, unfortunately, it will be an interesting area to keep an eye on.
Yes, unfortunately. And just one last one here. Do you have any concerns, or are we hearing any concerns from our recovered COVID-19 patients on reintegrating within society, or in terms of, like, they may feel a bit ostracized or cut off or stigmatized as a result of this virus. Are you hearing any concerns about that? If not, what sort of advice would you give these individuals or just the general public on these concerns?
I think that, yes, I mean, it's always a worry. That's why we're so keen not to try and to try our hardest not to identify everybody, because in essence, for many people, this will be a relatively mild disease. And once they're through it, they're through it. So in fact, they're the friends that you should go to now, because they're not going to give you COVID because they've had it, so they have the protection. But stigma is always a problem whenever somebody has been singled out for any particular reason. And the mental health helpline is there to try and give support should that be needed. I know that some people are struggling with it. Some people, especially the people who have been who have not yet had their negative tests, are struggling an awful lot, and I feel very much for them. And there are children involved as well. It's a concern. I think that they should reach out to their GPs, to the people around them that they trust, and if needed, to mental health professionals. I would hate anybody to feel isolated, so there are different avenues for them to reach out to.
All right, wonderful. Thank you, Dr. Lee, and that's it for me for now.
Dr. Lee, I do have one question before we move to Reshma. The one positive case that we have, is that on Grand Cayman?
Yes.
Thank you very much. Reshma, please go ahead.
Good afternoon, Dr. Lee. Good afternoon, everyone. Donna, you took my question. That's what I was about to ask Dr. Lee, where this one positive test came from. Is it, I may have missed it, but is it a community transmission, Dr. Lee?
Correct.
Okay. Now, the recovered cases, when you went through the results, it was quite quick. I may have missed it, but can you give us the recovered cases number?
Yes, so the recovered cases are 10.
Okay, so it remains at 10.
That figure is always a little bit delayed, because it could be that there are more that I just reported today, but it needs to be processed, and that figure is always a little bit more delayed than you might like it to be.
Okay, understood. Those who are in hospital, what kind of condition are they in?
I believe they're all doing well. I've heard no reports, and the numbers are dropping all the time, which is good. And I know that the two at Health City are stable.
Okay, great. Thank you. This is a kind of technical question, but maybe you can help me through it. Has Cayman's R0 numbers been worked on, or what are those numbers that will allow us to slowly reopen the economy, as the Premier talked about this week?
I think the real answer for that is to look at our graph that I've only showed you once, but I develop every day, because that's basically showing how many infections you have. And we have lots of days where there are zeros. So our R0 value is very low. I have not bothered to calculate it because it's very low. It would possibly be a meaningless figure. You always have to be careful when you're calculating these things for very small samples of population, as we are a small sample of population, because the smaller the sample, the more meaningless the values.
So in that case, does that mean our rate of infection, which is what the R0 really talks about, it's almost negligible then?
No, it's not negligible, because clearly we're counting it, but it's very low. And we hope it stays that way. Yeah.
Okay, so we're using this as a scientific basis for reopening the economy. We've seen the importance of contact tracing in that instance of reopening the economy, and also tracing how these cases originate. How many people do we have that are conducting the contact tracing, and are there any plans to increase the numbers as we slowly open the local economy?
There would only be a reason to increase the number of contact tracing if we had positive people to contact trace. We've only got one today, so they're coping okay at the minute. That we have increased in the past because we had a lot of people to do. We had to increase that cadre of people a good deal. So their numbers went up by maybe 3 times or 4 times what they were normally. We pulled in people from outside. So we pulled in people who have skills in that area, like from the Department of Environmental Health, some of whom have been trained in epidemiological surveys, have been trained specifically for this circumstance when we have an epidemic. And they are active now and are helping to manage our current group that are isolated. But at the moment, touch wood, we're not needing to pull in extra people, but we're well aware that that need may arise at any point. And it has been discussed.
Okay. Questions are coming in from the public with regards to the extension of the curfew and why we are continuing with it. I don't know if this is something you may be able to answer, or maybe the commissioner can also weigh in. But what's the reasoning behind extending the curfew for the 2 weeks if we're seeing the cases dropping, we're seeing lower numbers?
I think we'll get further answers from the Premier later on. That's a government decision, and I'll allow the panel to answer that later on this afternoon.
Okay, fair enough. Thank you, Dr. Lee.
Okay, thank you, Reshma. Now we go to Wendy from CNS.
Dr. Lee, can you clarify some of these figures that you gave, because I'm a little confused. In particular, where you spoke about the screening tests,
yes,
you said that 949 have been completed, but we don't have the results for all of those yet.
Yes, no, we do have the results for all of those, because we've essentially been screening for some weeks. In that,
right,
you know, when the flights come through and we have a whole bunch of asymptomatic people.
So you're describing those as screening as well?
Absolutely. So anybody that we've sampled that was sampled who didn't have any symptoms, we were just saying, you know, for some reason or another, we want to know the answer. That's been counted as a screen. But it does mean that Wendy, that we've counted all these people, which is great.
So the 11 positives from screening were largely travellers then?
4 certainly were. I would have to look at the other 7 to find out, but I bet your bottom dollar some of them were, yes.
So largely, the only community transmission that we've got from screening is the one today and the one the day before yesterday, I think it was.
I think you asked. I know people hate it when I say this, but I think you asked me about this a few weeks ago, maybe 10 days, 2 weeks ago, and I said that it was some number was around half a dozen of the community acquired. I think actually I was looking back at my graph where I've shown the graph, and it's around 15 where we've said no connections. But when we drilled down into them, I think the true answer is more like 7, where we absolutely have no idea where somebody's got it from, where it could have been that somebody was a taxi driver, and although they didn't actually meet somebody, we think, you know, for the nature of their employment, it's highly likely they may have come across a traveller. So that's been counted as somebody who had no connections, although, you know, there probably was a connection.
Okay. So, yeah, sorry, what I meant was that because I thought the screening had only just started, and so the screening results, I was talking about that particular, but I didn't realise that the screening was also considered for the people coming in.
Yeah, I mean, clearly the bulk of yeah, there's been huge amounts within the last 10 days or so, because about 10 days ago is when it started, so the numbers have gone up an awful lot, but we have included all of those done before that who were screened for other reasons.
I see. Also, just lastly, the testing on the sister islands, are those results in yet? The 200 on Little Cayman and the 245 on Cayman Brac?
No, they were only
that's what I thought.
They were only completed today on Little Cayman. I understand that the samples are coming over to Grand today. I had a flurry of texts just before I got up here from Dr. Velasamy, and they've done 245 tests on Cayman Brac, and he is hoping to have them completed his survey by Wednesday. And I've said if he can please push it up and get the samples to us earlier, that would be great. So hopefully by Monday we should have samples from Little Cayman reported upon, in order that we can take some decisions at the governmental level. The government can take some decisions. And next week, within a matter of days after that, we will have results for Cayman Brac in order for us to inform decisions.
Okay, great. Thank you very much. That's all my questions.
Okay, thank you to the media. Thank you very much, Dr. Lee. We move now to our Honourable Premier, Mr. Alden McLaughlin.
Thank you, Donna. Hello, everyone. Happy Friday. I have a lot of things to talk about today. I want to start, if I could have the camera put on this so I can hopefully explain where we're going. So this graphic sets out the COVID-19 suppression levels. We've been in level 5, maximum suppression, since the 24th of March, I believe, when we first imposed the hard curfew. And while there have been some tinkering at the edges, adjusting this, adjusting the other thing, that's where we've been. Where we're going starting on Monday is level 4, high suppression. So the other levels are moderate suppression, level 3, minimal suppression, level 2, and level 1 being the all clear. I think it was Reshma who asked, what is, well, essentially what is informing the government's decision and the commissioner's decision to continue with the hard curfews. So I hope to be able to explain those things as I go through the decisions we've taken recently and the decisions of Cabinet yesterday, which I will announce today. So we've always said that this government's approach to dealing with this epidemic starts with human life is the most important factor. Protection of the health and welfare of the people who live here is the most important consideration in any decisions that we take. Secondly, our decisions about how we approach this are guided by the best science that we can have access to and by the examples of the way other countries have dealt with it and the results. So the combination of measures were essentially really only two. One, suppress the contagion by physical distancing. And so when we talk about hard lockdown and shelter in place, all of those various measures are really aimed at that one objective, trying to keep people away from each other as much as possible to reduce the possibility of the transmission of the virus from one to another. That coupled with testing. It took us a while to get up to speed with the testing because we didn't have kits to start with. We had to have our machine checked out by PHE and our processes and all of those things. So that took us a little while to get into gear. But we are now really under full steam with respect to the testing. The results of the testing are help to inform the decisions that we take with the degree of suppression still necessary. I don't recall the exact number that Dr. Lee just announced, the overall number but we are almost at 2,000. That's a good number, but still not significantly representative of the overall population of the Cayman Islands, particularly Grand Cayman. I'm going to speak to Cayman Brac and Little Cayman separately. For us to actually relax and say, we're good. We can open back the beaches. We don't really mind people mingling and commingling and getting together because we're fairly confident now that the risk would be minimal. We're not there at all. The results this week have been hugely encouraging. I can't tell you, I'm not very demonstrative, but I'm as close to ecstatic as I usually get, really, about about the results of this week. We are definitely trending in the right direction. 392 today, only one positive, even though that's a worrying positive because we don't know how that person contracted it. I don't know whether this was a frontline screening or not, but it wasn't a frontline screening. Thank you, Dr. Lee. But I was going to say, people who are on the front line, I can certainly see how they could pick up the virus without having any idea how they came by it because they just interact with so very many people. Hence the reason why frontline screening is such a priority of the exercise that we are going through. So the more results that we get, and if they continue to trend the way they are trending, the more we will be able to relax the various suppression measures that are in place. I'm going to speak now to, or actually read, what the decisions are with the new shelter-in-place regulations, which were made by Cabinet yesterday. And then I will also talk about, as I said, Cayman Bracken, Little Cayman, but also about where do we go in 2 weeks' time when these regulations expire, if the results continue to trend the way they are, and if we have been able to get the numbers of tests up to where we think they need to be to give the government a clear or a pretty certain picture of the prevalence of the virus in the community. So the first thing I should say is the current shelter-in-place provisions, which we've been operating on for the last almost 2 weeks, well, 2 weeks, and which expired this morning, have been continued for today and tomorrow, Saturday. Sunday, as the Commissioner explained, is the hard curfew. The new shelter-in-place provisions, which Cabinet decided on yesterday, and which I will read about now, will come into force on Monday and continue for another 14 days. The Prevention, Control, and Suppression of COVID-19 Regulations 2020, which is the known commonly as the shelter-in-place provisions, which will come into force on the 4th of May 2020, repeal and replace the Public Health Prevention, Control, and Suppression of COVID-19 Ticket Regulations 2020 and the amendments to that. It should be noted, however, that the shelter-in-place provisions still remain in place, subject to a few changes. In respect of public places, the changes are as follows. Money remittance facilities will be open to the public and will be allowed to operate at any time during the hours of 6 a.m. and 7 p.m. However, money remittance facilities must operate in accordance with such conditions as may be imposed by the competent authority. And to access the competent authority, you write to curfew time at gov.ky. Post offices will be open to the public and are allowed to operate at any time during the hours of 6 a.m. and 7 p.m. That is from Monday, the 4th of May. Retail banks, building societies, and credit unions will be allowed to operate during the hours of 9 a.m. to 4 p.m. In respect of the restriction on certain activities and operations, the changes are as follows. Visits to educational institutions are only allowed by persons who are involved in the distribution or collection of school supplies from those educational institutions. Persons will now be allowed to conduct the business of a mail or parcel courier service, but only where the person is providing only for the collection and delivery of mail or parcels. Persons will now be allowed to conduct the business of a pet grooming service, but only where the person is providing for the collection and delivery of the pet. Persons will now be allowed to conduct the business of a retail store, but only where the person is providing for the delivery of goods. Persons will be allowed to conduct the business of a car dealership, but only where the person is providing for the delivery of vehicles. Persons will now be allowed to conduct the business of a laundromat, but only where the person is providing for the collection and delivery of the items. Persons will be allowed to conduct the business of a car wash service or a tire repair service, but only where the person is providing a mobile car wash service or a mobile tire repair service. Persons who provide pool maintenance services will now be allowed access to private strata pools, but only for the purposes of cleaning and maintaining the pool. And by private strata pools, that means your private one at home as well, because that word strata might confuse some people, but they can come to your home. This has been a pet peeve of many people, so I'm doing my very best to make it clear. In respect of the essential services personnel, the following persons have been added to the list of persons who are exempt from the shelter-in-place regulations, but only while they're carrying out their official or employment-related duties. Persons who provide pain management services or persons providing treatment of chronic pain. Persons who are involved in the distribution of school supplies at educational institutions. Postal workers and persons employed by mail or parcel courier services to collect and deliver mail and parcels. Persons who operate retail stores and persons employed by them to deliver goods. Persons engaged in the provision of pet grooming services and persons employed by them to collect and deliver pets. Persons engaged in the provision of pool maintenance, grounds maintenance, landscaping, and gardening services. Persons who provide mobile car wash services or mobile tire repair services. Persons who provide laundromat services and persons employed by them for the collection and delivery of items. And for practical purposes, laundromat services means your dry cleaner as well. Persons who operate car dealerships and persons employed by them to deliver vehicles. We've also extended the times until which persons who provide food delivery services or grocery delivery services may operate, as well as extended the time for persons to collect food. Persons employed by restaurants to provide food delivery services may do so until 10 p.m. Persons employed by businesses other than restaurants to provide food or grocery delivery services may do so until 10 p.m. Persons who travel to restaurants which provide drive-through or curbside collection of food or provide for the takeout of food may do so until 7 p.m. And the reason we're able to do that is because the Commissioner has reduced the curfew period by an hour so that hard curfew comes into effect at 8 p.m. rather than 7 p.m. as it has done these past 4 or 5 weeks, whatever it is. In respect of exercise, persons are allowed to exercise outdoors for no more than 1.5 hours per day, which has been the case all along, between the hours of 5:15 a.m. and 7 p.m. So there's been a 15-minute increase in the window of opportunity for exercise. And for those who may ask why 7 p.m. and not 7:30, is because by 7 o'clock it starts to get dark and the Commissioner wants you to be on your way home rather than walking or running on the road. In respect of, I just did that. Yes. Persons are reminded, however, that they cannot exercise around or in a public pool or a strata pool or in a public gym. Persons are also reminded that they cannot drive the vehicle to any place for the purpose of engaging in exercise. In respect of essential travel to fulfill a legal obligation, we have now expressly included attorneys at law who have to undertake essential travel to participate in or represent their clients in any legal or related proceedings. In respect of essential travel to certain places, we have added post offices and money remittance facilities to the list of places which persons may undertake essential travel to on their allotted days. Persons who have to travel to educational institutions to collect school supplies shall also do so on their allotted days. This, of course, does not apply to persons who have to distribute the school supplies. As a reminder, therefore, persons whose surnames begin with the letters A to K shall undertake essential travel to supermarkets, convenience stores and mini-marts, retail banks, building societies and credit unions, gas or refilling stations, and money remittance facilities on Mondays, Wednesdays, and Fridays. Persons whose surnames begin with the letters L to Z shall only undertake essential travel to the places just referred to on Tuesdays, Thursdays, and Saturdays. Persons are also reminded that where a person has what I will call a double-barreled surname, the first name of the person's double-barreled surname shall be the name used for the purposes of determining the person's allotted day. Now, those who have been following carefully what I've been reading would probably discern that there is a theme that runs through the various activities that are now being permitted that hitherto have not been permitted. That is that it is essentially all about, with few exceptions, the money transfer facilities and the post offices. It is about the delivery of the goods or services. So in this second level of suppression, level 4, second in terms of severity, we have released more than 6,000 persons, by our estimates, to go out and do business who previously were not able to do so. But we are still concerned about the gathering together of people, activities which require or cause or encourage the gathering together of groups of people. Hence, the emphasis on the delivery of the goods or services rather than the person who is purchasing the goods or services having to go inside an enclosed space. We just couldn't find a way to get around that with respect to the money transfer services or the post offices or indeed the supermarkets. So there's some places you absolutely have to go to get the goods or the services. So in this second, or in this level 4 suppression measures, we're putting more people on the road, but we are still managing the risk by still restricting the opportunities for people to, as I say, rub up against each other and cause the transmission, the community transmission of the virus. God willing, and things continuing to go as well as they are, we hope in 2 weeks' time with the test results that we will be able to move to level 3. And level 3, we anticipate there would be the opening of a number of facilities. I know some that people are keen about, like the Home Depots, the hardware stores, those sorts of places. We would anticipate being able to allow those to open. But for now, they are able to provide delivery service. And I probably shouldn't say this because I'm encouraging more questions, but we are already looking, even during this period, those that are able, those hardware, Home Depot type places who are able to demonstrate to the competent authority that they can safely do curbside delivery or from their parking lot or whatever, we certainly are prepared to look at authorizing that even during this 2-week period. The concern, as we say, is we're trying to manage or minimize the risk. There's always risk once you do this, but we can't keep everybody locked down until Christmas when everything would be fine, I'm sure. So we have to try to manage the risk. As a country, as a community, we've come too far, and we've made too many sacrifices to throw this all away by rushing to ease the restrictions and wind up in the position that a number of places have found themselves where you have another outbreak of the virus. I know the beaches and the fishing continue to be a major sore point for many people. Believe me, we understand there is relentless pressure on us to ease this. We understand. But as Governor Ron DeSantis in Florida is learning very painfully, and as Governor Newsom, I think he is, of California, has already learned, beaches are one of the principal places where community transmission of the virus occurs. And it is almost impossible to police, as the commissioner and his team have discovered the hard way. It is just too big an expanse, and it requires too many officers to stand by vigilantly to keep people from. It's human nature. You're at the beach, you're having a beer, you want to talk to somebody. No one wants to stand there and talk to themselves and look at the sea. I mean, so you're trying to manage human behavior, and you're forcing people to do things that don't come naturally to any people. We're social animals. So I just beg, again, as I've done, for patience. We know this is terrible in terms of how it makes you feel, but we've come too far. And I want people to believe that if we succeed in the next 2 weeks, as we have succeeded so far, we will be able to release the beaches. We will be able to allow people to go fishing again. And we will do so with confidence, reasonable confidence, that the person next to you isn't carrying COVID-19. That's where we're trying to get to. Now, let me speak particularly to Cayman Brac and Little Cayman. We have essentially tested everybody in our public health, not me, in Little Cayman. There's 200 plus tests, and I think there are 208 or 210 residents there. So that's been done. We've swabbed them, shall I say. The tests are still to be actually performed. Making very good progress in Cayman Brac. And in another day or two, the swabbing for those that we intend to test in Cayman Brac should be done. It is not the intention to test every person in Cayman Brac, but representative samples from the various community groups, frontline people, people who work in the restaurants, at the hotel, people who have a lot of interface with other people and the public generally, so that public health can take a view about the likely prevalence or not of the virus in that community. There's only been one positive case there, and I think that we've had results for about 90 people. So the indications are very, very good. Little Cayman is a very small community. We've been locked down now for about 5 weeks. There have been no cases from Little Cayman reported, but also no indications of any people being ill. So if I were a wagering man, I would wager that all of the results from Little Cayman will be negative. Now, the great news for Cayman Brac and Little Cayman which have distinct borders, and those borders have been shut down, only allowing in essential supplies and people, is that if the results are what they are expected to be, as early as possibly Tuesday of next week, both curfews could be lifted from Little Cayman, with Cayman Brac shortly to follow. So they would not any longer be subject to any of these restrictions, except, of course, and we'll need to think carefully about that, restrictions still on the numbers of people who are allowed to gather publicly and public functions, and of course the continued insistence on physical distancing and the protocols around washing your hands and respiratory etiquette and so forth, which are now, for all of us, commonplace in this time of epidemic. But we are doing everything we possibly can, pushing and shoving. And I know we're making a couple of people, some people, a little uncomfortable on our insistence that we have to have Cayman Brac and Little Cayman as an absolute priority. Fishing is greatly loved across all of these islands by local people. Sometimes I don't think that people who come from somewhere else understand what a passion it is for many local people. But in Cayman Brac in particular, it is a religion. And so, so there is immense demand and concern that people are not able to fish. But I'm going to use up every bit of goodwill and love that Cayman Brackers have for me, and even walk out on a limb and to say to you that Alden promises you that we are going, if assuming your results tell us what all of us want to hear, we are going to release Cayman Brac from the restrictions over the course of next week as early as we possibly can. Results being what we all hope them to be. Please, I beg you, don't give Julian Moores any more pressure than you absolutely have to, because when you pressure them, they pressure me and they pressure the governor. And we can't take much more pressure now. So I beg you, Cayman Brac and Little Cayman Brac especially, please stay with us for just a little bit longer. And then you'll be released, while people in Grand Cayman will still have to labor under some degree of restrictions for a while yet, because the numbers of persons tested need to increase fairly significantly. I also want to address, well, let me start with an appeal. We are starting to suffer again from the leaking of information to the public. There's a story in Cayman Mile Road today. Clearly, Cayman Mile Road were provided with an early copy of the decisions, of the issues that Cabinet had to consider and decide. Now, this isn't because this is a military secret or something politically sensitive, but when information is released into the public domain before it's actually been, the decisions have actually been taken, all it does is cause questions, concerns, confusion, and myself, my colleagues, and the governor to spend endless amounts of time refuting them, calming people down. It really serves no positive purpose. And I regret to say this, but it's civil servants that are doing it. I appeal, please contain yourselves. We all need to get through this together. This is really, really unhelpful. It's not a case of embarrassing anybody. It doesn't embarrass us in the slightest, but it requires us to spend a whole lot of time, as I did last night, Minister Hugh did last night, His Excellency the Governor had to do, on the issue about construction and how we're going to treat with construction, which is one of those categories of endeavor, of industry, that will be dealt with in the next phase. When there are these discussions about issues, a whole lot of things get thrown up, because that's how you are able to debate the virtue or lack thereof of a particular position. But when you put out the information as though it has been a decision, and in this case, there was supposedly a list of companies, of the big companies, big construction companies, who had been approved to go. And then, of course, the obvious question is, so what happened to us small size, medium size construction companies? We're not going to be able to operate. So we are doing everything we can to be as fair as possible, while bearing in mind that risk always must be the principal consideration. So we are, in relation to the construction, we are working with Dr. Lee on a plan as to how we are able to ensure that small construction companies are able to operate. I mean, the simple answer to it, in practical terms, is if you've got 4 or 5 or 6 men, we test them all. Then you can go ahead and go to work. And this worker doesn't have to be spending his time or her time worrying about, is the person I'm working with likely to be positive or not. So, but there are practical considerations around all of these things, and we're still trying to work out the details of how we do all of these things. But panicking people in the construction industry is just unhelpful and a waste of time. So please, don't do it. What else do I have? Right, so as an example of that, we want to, as we've done with respect to the runway rehabilitation project at the airport, we want to seize the opportunity that we have now, where there's a lot less traffic on the road, to get some of the NRA work that was underway restarted and completed before we get back to major traffic jams again. So, in keeping with the same principle that I just spoke about, we are testing key members of the NRA crew tomorrow, and it's about 10% of the crew. And so, assuming all of those tests go well, you will see NRA staff on the road starting next week, starting to redeploy and starting to resume some of those projects. I also have what I hope is some good news about, or from the Water Authority, which the Minister, Mr. Juliana O'Connor-Connolly, sent to me just a short while before the conference began. So I'll just read it, because I haven't been briefed. I'm just reading the notice that I've been sent. The Water Authority Cayman continues to provide wastewater services along West Bay Road. Recognizing that many businesses have been affected by the pandemic, the Authority continues to seek ways in which it can support the business community during this difficult time. As business is unlikely to return to normal in the near future, particularly the hospitality industry, the Authority will, upon request, discount wastewater bills for April through June for commercial customers along the West Bay Road corridor. The Water Authority will provide further details of how customers can apply for this discount on Monday coming, the 4th of May, and information will be shared on the Authority's website, www.waterauthority.ky. And so that's another, I think, will be a very welcome measure to help ease some of the financial burden that commercial customers along the 7 Mile Beach corridor are experiencing because they simply have very little business, some none at all. And then a final note from the Honorable Attorney General, dealing with a matter that I was asked about and did deal with at the last press briefing, plus an additional note. The Attorney General says it appears from concerns raised that two matters may require clarification. One, where parents are not living together, but either by agreement between them or by order of the court, must have access to their children for the purposes of shared custody and care. They are entitled to do so. The shelter-in-place regulations notwithstanding. As these arrangements are often by agreement between the parents rather than by order of the court, it would not be necessary for the police to require them to show a court order. Where there is no order, a letter of agreement between the parents will suffice. And separately, under the regulations as originally promulgated and as currently in place, a person may leave a place of residence in order to avoid being harmed. This may include changing one's place of residence for such reasons. So that is to deal with incidents, I think, principally of domestic violence, and to say that notwithstanding the regulations and the shelter-in-place provisions, or even the hard curfew, if you believe that you will be harmed, you are entitled to leave that residence and seek somewhere else, and you will not be in breach of the law. Sorry for being so long, but it really was necessary. I don't think I had too many unnecessary words in there.
Thank you, Premier McLaughlin. Your Excellency.
Okay. Thank you very much, and good afternoon, everyone. I also have quite a bit to go through, but I'll try and be brief, and I'll leave a couple of things out until next week. I mean, I first of all just want to say, I mean, those test results, over 390 negatives, that's hugely encouraging, and I'm sure sends us into the weekend with real confidence and hope that our plan and our strategy is working. I also want to commend the Premier for that impressively clear explanation of the plan going forward and where we are. This is a cautious, sensible and measured plan worked through with a huge amount of detail to make sure that we are in the best possible place. And it's, I want to repeat again, it's based on World Health Organization best practice. It's been discussed with Public Health England, and our excellent Chief Medical Officer is absolutely central to that plan. It manages the risks and it builds in review points as the suppression levels the Premier spoke about. As we move now from level 5 to level 4 high suppression, as we move to each of these points, we have review points, evaluation points to check whether we're going in the right direction. Can we move forward, or do we hope not, have to even go back and impose stricter results? And of course, the final element is the ongoing testing, and we really are ramping that up now. So I know we're asking an awful lot of you, but I really do believe that this short-term sacrifice we're all having to go through will be worth it. So huge thanks again to everyone for your cooperation. On evacuation flights, both flights to La Ceiba, Honduras are now full. A reminder that all passengers need to send their medical certificates to Maria Lung at fco.gov.uk, maria.lung, L-E-N-G, at fco.gov.uk by close today for the flight on Monday and by Tuesday the 5th for the flight on 8th of May. Also very pleased now to say we have a flight with Cayman Airways to San Jose in Costa Rica confirmed for Friday 8 May, and you can book your tickets directly with Cayman Airways on 949-2311. A request, as I've said before, was sent to the Dominican Republic government for a flight, and we're still awaiting confirmation that permission has been granted, but we're confident we will get that and hope to announce something next week. And then finally, on evacuation flights, the emergency travel helpline and the online tool particularly has been very successful. So do continue to use the online tool, and we probably will be reducing the phone coverage from Mondays to Fridays from 9 until 1 because everybody is using the online tool. So please continue to use the online tool, www.explore.gov.ky/travel. I also want to say a word about the Royal Navy ships that are in the region, RFA Argus. RFA Argus is one of the Caribbean Task Force ships and will be in the Cayman Islands area on Monday, the 4th of May, Grand Cayman, and also on Tuesday, the 5th of May in Cayman Brac. I mean, this is part of the normal visits that happen every year, but of course it's not normal because they would come ashore, but they won't be coming ashore because of the COVID-19 risk. But you may see the ship offshore. On this ship, we have 3 Merlin helicopters and 1 Wildcat helicopter. And the plan is on Monday to fly 2 helicopters in the morning on a recce of Grand Cayman and 2 helicopters in the afternoon on a drugs interdiction exercise with one of our RCIPS Marine Unit vessels. And this ship also has on board disaster relief stores as well as Royal Engineers and specialist personnel who can help repairing and restoring vital services and would come to the assistance of any overseas territory if that were required during hurricane season. So one of our RCIPS helicopters will meet these Royal Navy helicopters airborne and conduct familiarisation over the radio in a loose formation. They'll be looking for key areas and landing sites, but as I've said, no landings will be made on this occasion. But this is all really helpful hurricane preparedness for us. So you may see the ship and the helicopters on Monday and Tuesday next week. I then want to say a word about the disaster relief funds. You probably will have seen some press coverage earlier today, and the Premier and I both very much want to welcome the formation of the R3 Cayman Foundation and the planned reactivation of the Cayman Islands National Recovery Fund, which was formed in the aftermath of Hurricane Ivan. I'm very grateful to everyone working to make these 2 initiatives a success and to the funders who have very generously devoted their time and resources. The initial donation from Ken Dart was a hugely important catalyst, and we would like these 2 funds to work collaboratively together and enable Cayman to be even more resilient in tackling the threats that we all face from natural and man-made disasters. And then finally, I just want to say that for all civil service staff, just to note that the changes we're making next week to shelter in places will have no impact on current operations in terms of civil service staff and where they are operating. The Deputy Governor will be speaking directly to all civil servants because as our plan develops, there will be changes, but there are no immediate changes for next week. Thank you.
Thank you, Your Excellency. Minister for Health.
Thank you, Donna. Good afternoon, everyone in Grand Cayman, Cayman Brac, and Little Cayman, and all our Caymanian diaspora listening in. And also want to say great job, Premier, and all this. And I also commend you and the team. Some people may be wondering why I'm not doing the languages anymore. And I know it was a popular thing to some. But we are now at a different stage in this pandemic, and it appears from our consistently low infected results that persons have got the message and are helping us to keep the spread down. So this COVID-19, as it's called, it's no joke, and some may not appreciate the work that we have done as a government to bring this to calm, as we are reminded that deaths were estimated to be 900 people in the Cayman Islands. This COVID-19 is not prejudice. It does not need a permit for entry, and it is rarely seen. This panel deserves a lot of credit for being so committed to saving our people. But we could not do this by ourselves, and we thank all of you for your support and the staff in all areas. As I've said, politics and abhorrence has no place in this pandemic. None whatsoever. We have to work together as a country and show true unity and togetherness. Otherwise, if we're not careful, we'll lose the battle. Yes, things are looking up, but let us be reminded of the past and that no one person alone can beat this. It will take the country's effort, no time for a separatist mentality. The most severe pandemic in history was the Spanish flu of 1918, as you've heard. It lasted for 2 years in 3 waves. Are you with me? With 500 million people infected and 50 million deaths. Most of the fatalities happened in the second wave. The people felt so bad about being quarantined and social distancing measures with the government hand was forced. And when the government first lifted the measures, the people rejoiced in the street with abandon. In the coming weeks, the second wave occurred with tens of millions died. Let us not repeat history in 2020 as the government attempts to relax same. Scripture reading for today is Psalms 121. I lift up my eyes to the mountain where my help cometh from. My help comes from the Lord, the maker of heaven and earth. He will not let your foot slip. He who watches over you will not slumber. Indeed, he watches over Israel will neither slumber nor sleep. The Lord watches over you. The Lord is your shade at your right hand. The sun will not harm you by day, nor the moon by night. The Lord will keep you from all harm. He will watch over your life. The Lord will watch over your coming and going, both now and forevermore. May the Lord add a blessing to the reading of his holy word. I want to say happy birthday today to Sean Lucas Martinez, who sent me a message. He's 13 years old. Happy birthday to you, Sean Lucas. Shout out to all the prayer warriors out there. They say prayers move mountains, and you're sure doing your part to keep the Cayman Islands safe and the countries where your extended families are at. I thank you for taking the time to fast and pray. Also want to shout out all those persons who could have chosen so many different paths in life, but chose to be a good, contributing citizen. Some may not understand how important this is, but most will. It is important that we grow as a country for all. And as I said, make everyone feel like they can be great too. Also want to announce the chairman of the Cayman Ministers Association, Torrance Bob, informs of the 72 Hours of Fasting initiative in progress. Please join them. And thank you, Pastor Bob, for your prayers for me, my family, and the healthcare workers. It was so beautiful that you all got Grace Byers, one of our own Caymanians, an international movie star, superstar, and Pastor Al did the commercial. And it's also praycayman.com. You can find this on. President Theodore Roosevelt spoke about the man in the arena. It is not the critic who counts, not the man who points out how strong the man stumbles, or where the deer of the deeds could have done them better. The credit belongs to the man who is actually in the arena, whose face is marred by dust and sweat and blood, who strives valiantly, who errs, who comes short again and again, who spends himself in a worthy cause, who at best knows in the end the triumph of high achievement, and who at worst, if he fails, at least he fails while daring greatly, so that his place shall never be with those cold and timid souls who neither know victory nor defeat. So I say to you, let your life reflect the faith that you have in God. Fear nothing and pray for everything. Be kind, be strong, and trust God's word. Also want to say today, talk a bit more about mental health. As many of us know, the topic is extremely important, especially during this time. It's very near and dear to me. Stress, anxiety, and depression associated with the coronavirus lockdown may be something that we all are feeling. The idea that there is a virus, an unknown, unseen opponent, wreaking havoc all over the world can certainly be an overwhelming thought for most of us. I've been receiving reports from people in the community, many of them experiencing more instances of physical effects like insomnia or headaches, along with lessened or increased appetite, for example. Some of us may even find ourselves using not so healthy things to try to cope, like smoking or over drinking. And although we cannot all empathize that we are under stressful conditions, it is important to always remind ourselves that these types of coping mechanisms are contrary to what doctors across the world are telling us to do right now. Also, as Dr. Lee kindly reminded us this week, these things carry heavy health price tags, such as cirrhosis of the liver and lung cancer, whether there is a health crisis or not. I want to remind you that we all need to take stock, even if you don't think you're struggling to cope with the current situation. As we continue to fight this, the truth be told, we will never further strain, never will we feel further strain in our lives, whether it will be in waiting on test results or worrying about present, future finances. None of us are immune to this stress, and in the effects it can have on our bodies and minds can take a toll. Yes, we may each deal with it differently, but it affects us all. We know this is not limited just to Cayman. We have seen many reports of varying issues related to mental health and coping all over the world. Emotional health is very important to all of us. We are all human, and as such, all subject to becoming discouraged, overwhelmed, depressed, stressed, inability to sleep, anxious about the future, or maybe even withdrawing from our own family members while facing what called cabin fever in this rare situation. Please call 1-800-534-MIND, M-I-N-D, anytime between Mondays and Fridays, 9 a.m. to 5 p.m., to talk to someone who can help you or your family members through this. On another note, I'm pleased to announce today that musicians will receive a one-time stipend of a whopping sum of $1,000 from the government through my ministry. This stipend will provide some much-needed relief to our musicians who have been so severely impacted, especially by the tourism industry downturn. Ministry staff and the Cayman Music and Entertainment Association, Mr. Sean Smith, Notch, are working together on this initiative, which will be paid out by the end of May. Thank you all to musicians who have reached out to date on this initiative. You will be contacted in the following week with additional details in this regard. You can email natasha.powell@gov.ky or 936-2369. Finally, I'm pleased to advise that each MLA from all constituencies were contacted earlier today confirming the availability of some disposable masks for distribution to their constituents. Although these are just an initial supply of disposable masks, the ministry is committed to working with others such as New York Group and the team at the Red Cross in sourcing additional reusable cloth masks. If necessary, as and when capacity allows, I understand that the current masks through these groups are progressing well, and I thank the team there for doing a great job. Also, got some other good news, some regional cooperation. We are sending 5,000 test kits to St. Lucia, and in return, they are gifting us with some pipettes. They are very needed and in great demand and not easily acquired. The HSA needs these to actually as a part of a mechanism to do our testing. And we really thank St. Lucia, and this just shows how regional cooperation can really make things work. Also, yesterday I want to announce that we arrived 30,000 PPE suits, and a big shout out to the HCCI team, the HSA, Shamari, Lizette, Dr. Williams, Don Cummings, and the governor and his office for assisting with the diplomatic support in China. I'm also encouraging you at a 6-week mark to take stock and evaluate yourself and your family's mental health. Let us continue our best to take time for each other, to check up and check in with others, to take care of ourselves. Are you spending enough time doing positive things? Are you taking care of your physical health by exercising and eating healthier? We all need to ensure a good balance of spiritual, physical, and emotional health. The bright spot in the dark pandemic is that we are looking out for our family and friends more readily and lending a helping hand because we are all in this together. I thank you, and God bless.
Thank you very much, Minister Seymour. We're going to go right into the questions. The first one that I have is for the Honorable Premier. Honorable Premier, do we have any idea when the airports may open? Will it be in May, June, July?
Well, they're currently closed until the 31st of May. We haven't, in fact, we haven't had a discussion about it in some weeks now, but as I've said more than once, that's going to be guided by what's happening around the world, particularly areas that we normally fly to. And it's not looking good in the US, not looking good in the UK. Regionally, things are not so bad, though, so, you know, we'll see.
But if persons have plans or have made plans to travel earlier in the year for the summer, they should probably go ahead and say they're not going to be able to travel.
If I were them, that's what I'd do, yeah.
Yes, okay.
We've canceled ours.
Yes. Okay, thank you. We're going to go straight to Wendy from CNS. Wendy, go ahead. Wendy, please go ahead.
Sorry, I had my mute button on. I wasn't expecting it to come that quickly. I have a few questions for members of the panel. First of all, on this the leaked document about the phase one, it did actually include the farmers market and the fish market and releasing fishing boats. So I just wondered what had made the government decide not to do that.
No, the farmers market is among the, and the fish market are both within the provisions that will be allowed to open. And this is what happens when you leak things. The fishing boats refer only to commercial fishing vessels that go out to sea for days on end or sometimes weeks on end and return and sell their catch here. They are owned generally by Caymanians, but are crewed generally by Hondurans. And they will not, as has been the case, they will not be allowed off the vessel while it is here. They're usually here for 3 or 4 days, and to distribute their catch, and then they go back to sea. But yes, the fish market, in fact, the plans are that the fish market will temporarily be moved to the port where the cruise ship passengers normally come off, and appropriate measures are being put in place to ensure the requisite physical distancing and that the risks are being managed. Similarly, with respect to the Hamlin-Stevenson's farmers market.
Okay, great, thank you. One other thing that I'm wondering, because it also points to the phase one dealing with outdoor things. So what about the iguana colors?
I believe they are, it is contemplated that they will be allowed as well. I don't want to go too far out on a limb with that one, but so a number of these things can be managed, as has been the case, through approval by the competent authority, even though they are not specifically named in the regulations. But go ahead with your questioning. I'll have a look at the regs that I have here and see if they are specifically named.
What goes with that as well is other pest control, because I know pool maintenance has been big, but we've had thousands of questions about pest control.
Right. Well,
so I just wondered, is there is that going to be included?
Right. So it's not possible to, well, I suppose it could be possible theoretically, but to name and list every single possible variation of service that is provided in the regs expressly. That's why we have the competent authority. And again, whether or not permission is granted is determined by risk. So if you want pest control people to come inside your house, that's probably going to be a no. But if they were going to come and provide some service around the yard or something, possibly, I'm not making the decision now, I'm just saying possibly that is something that the competent authority would grant permission for, because the risk of their interacting with people there is quite limited.
Okay, so we can just advise people to contact curfew time.
Right curfew time, and make your case. And if the regulations permit then they can consider sometimes people ask for things that are governed either by the Commissioner of Police or by Dr. Lee through the public health or the police law, and so they don't have the authority to deal with some of those things. But normally, as I say, if the regulations permit them to do so, whether they will take into consideration, what does this particular activity involve, and is it going to require significant interaction with a number of people? And if not, then you'll probably get the permission to do so. I believe you may have had about 10 requests for inclusion of various things since I've been sitting here. So we know, but we're used to dealing with that now. And as I say, as long as it doesn't significantly increase the risk of community transmission,
okay,
we certainly do everything we can to accommodate people.
Okay, great. I've got one more housekeeping, and then I've got a more major question. The housekeeping one is we've had a few people who've had new babies recently, but they can't get birth certificates, and so they can't leave. So some of them were wanting to, go on the evacuation flights, but they've not been able to get birth certificates. Is there a solution to that?
Have they said why?
Because they can't get access to the general registry, and they're not issuing them, apparently.
Well, okay. They are providing a number of services online, but I don't have that level of detail, so I'll inquire. I'm sure they're listening anyhow.
Okay, great.
I'll inquire.
Okay, great. And the other thing is more to do with the management of government going forward, because it's beginning to be clear that there are certain sectors or certain cabinet jobs that are going to be a lot more bulky and, more difficult than others. And so whether you're going to be doing some cabinet reshuffling or moving civil servants around, because obviously tourism, not much work happening there. Your own portfolio of the Ministry of International Trade, obviously can't be much happening there. So I just wondered whether you'd given any thought to rearranging your ministers or rearranging the departments within the ministries.
Yes, I give thought to a lot of things, but I'm not about to give voice to it yet.
I was expecting a really good long answer. About who was going to get what job. Never mind. Thank you. I'll ask that again later. Bye. That's all my questions. Thank you, Donna.
Okay, thanks, Wendy. There's tons and tons of questions coming in. I just want to say to the public, you send the questions to the media, to myself, to everybody in the room. And if we can't ask your questions on air, don't feel bad. We just have a limited amount of questions because of time. I do have a few more questions for the Premier. One relates to landscaping. Persons are asking if what you're saying is those persons are allowed to go and do people's yards.
Yes, they actually have an express provision in the regulations. Let me find it. Got my pages mixed up. Persons engaged in the provision of pool maintenance, grounds maintenance, landscaping, and gardening services. So yes.
Okay. What about you mentioned tire repair? What about mobile tire repair? What about persons who need their vehicles actually repaired or serviced?
Aha. So this is one that we've grappled with, as we say, over and often, and we haven't been able to come up with and this is a major issue. Come up with a short of reopening the garages, and if you reopen the garages, and I've actually had my mechanic tell me this, if you open the garages, you now have to open the places that we can get parts from. So one, it's a knock-on effect. So I'm afraid I have to disappoint people and simply say that in 2 weeks' time, that's when we'll be able to deal with that, assuming things continue to look well.
Okay. And two more quick questions for me. One, the persons who are the industries that are now have less restrictions on them, do they still have to apply to curfew time?
Well, how this works, how the system is set up is like this. So if you are declared an essential service, then you are covered. But what you need is evidence of it when the police stop your workers along the way. So your workers need a letter that says that they are an essential worker in this essential business. So it's not you need permission for curfew time if you're in the regulations to operate.
But you need the document.
But you need the evidence, otherwise the police can say, well, I hear what you say, but.
Yes. Okay. I get it. We're going to go now to Reshma from the Cayman Compass. Reshma, please go ahead.
Thank you, Donna. I have quite a few. I'll start first with the 6,000 workers that you are expecting Premier to be back out on the road. Are there any plans to test these workers as they head out back into the community to provide services?
No, that's why we have been so careful about the type of essentials, type of business we're allowing to reopen, and that it is essentially delivery of the service or delivery of the product, so that we limit the opportunity for interaction between people. The next phase, level 3, moderate suppression, is when we increase risk of personal interaction because we are reopening enclosed spaces. The hardware stores, the Home Depots, the garages, those sorts of things, the part stores, the automotive part stores and so forth. So we will use this period, construction, we will use this 2-week period to ramp up testing of frontline, well, when I say frontline staff who are working in the businesses that we propose to reopen in 2 weeks' time, and to get a representative sampling of those so that we can make the proper decisions. We have enough evidence to make the proper decisions around risk. None of this is carved in stone. I mean, this is going to be influenced by test results and by experiences. So I don't want anyone to hold me or the government to task to say, well, you promised that this is what you're going to do in 2 weeks. Subject to.
Okay, fair enough. I've had a lot of questions come in asking what does the other phases look like? How much are you prepared to share with us at this point? I know you just talked about phase 3, but what would phase 2 look like? What would phase 1 look like? And at what point can we get the beaches open and people going back out to fish?
Right, so I've dealt with that already, but I'll repeat it. I expect that all things being equal, that would be the next phase. People being able to go back to fish, be able to go to the beaches. For Grand Cayman, Cayman Brac and Little Cayman, very early next week, we hope.
Okay, fair enough. Now, at the last briefing, I asked you about the disconnections and the situation with the CUC and the other utility providers. Have you been able to get any clarification on the process going forward when it comes to disconnections?
Well, CUC themselves have put out a flyer, which I've just seen, in which they've said that essentially that they're honoring their undertaking not to disconnect for 3 months. So I haven't had any indications that any of the agencies have indicated anything other than they are going to be as helpful and as forgiving as they possibly can during this most difficult period. So, I mean, if there are specific instances that indicate otherwise, then please let us know and we'll take it up with them.
Okay, thank you. Minister Seymour, this question is for you. You shared that we have sent 5,000 kits to St. Lucia, and they've gifted us something in return. It wasn't clear what you said we have gotten in return. Can you just clarify that, please?
Yes, it's a very funny word. I'll actually spell it for you. Pipette, or pipettes. Pipettes.
It's like a little straw.
Depends on if you're French or Spanish. P-I-P-E-T-T-E, as I've been instructed by Dr. Lee. And it's a little plastic apparatus that's necessary to use within the testing. But it's very, very necessary, and it's in great demand and hard to get.
Okay, great. Thank you. I just wanted to get that word in. And building on that in particular, Premier, can you say if the government has entered into any other agreements with our regional partners for the sale of test kits? And if we have, can you share with us those countries and quantities?
Yeah, actually, I think Dr. Lee has a better handle on which ones are going ahead now than me, but we've had many requests, but Bahamas for certain, obviously Bermuda, St. Lucia, and Barbados were the first one that we did. So I think there are some other requests floating around, but I'm not sure where they're at.
Okay, no problem. My final question, and this isn't a particular issue with reference to the labor law and the situation that was brought to our attention at the Compass, and I'd like you to speak to it. Now, we've heard that there are some employers who are planning to take advantage in some way of the 2 months leeway that they're getting with the severance pay. For example, we've been told that employers are looking at bringing on workers 1 week before the severance pay holiday, for want of a better description, ends, with the plan of allowing them to work through that period, cross the threshold, and then once again lay them off so that they avoid paying severance pay. Can you speak to that and the legal implications of doing something like that?
Well, I'm not a lawyer anymore, you know, so I'm not sure I'm going to. I haven't practiced in 20 years. I'm not sure I'm going to venture there, but if that is the case, what I would advise is that they should, the employee or employees who feel they are being taken advantage of should file an appropriate report with the Department of Labor and Pensions so they can be properly investigated.
Okay, thank you very much.
Okay, thank you very much, Reshma. We're going to go now to Shanda from Radio Cayman.
Thank you, Donna. This question is actually to His Excellency, Governor Martin Wilburn. I'll start with you first. We received a concern or complaint from one of our listeners about the lack of social distancing on a recent British Airways outgoing flight. I don't know if you could speak to this one, but there were about 210 people on the flight and no social distancing being practiced. Is that being addressed, or can you give us some insight into how officials there or how you guys are proceeding with addressing social distancing procedures during this time, during the repatriation of the flights?
Can I just ask which flight you're referring to, Shanda? The last okay. Flight, the one that just left this week?
Okay, it doesn't specifically say which BA outgoing flight. It just said recent BA outgoing flight. So not exactly sure what that is. Again, is a concern or complaint from one of our listeners.
Well, I'm afraid I don't have any information on that, but I will find out. But if it's an outgoing flight, it's obviously a matter for British Airways, and then it's an issue for the UK when those passengers arrive. So I don't see that carries any risk for people in Cayman. So I don't quite know why people here would be concerned about that.
Okay, thank you for that one. My question now goes to Police Commissioner. Is he still around?
He sure is. Just a moment, Shanda.
Okay, so again, this question is from one of our many listeners, and we thank them all for submitting questions and concerns. Mr. Derek Byrne, is it okay to sit on the pool deck or anywhere around the Strata Pool area once people are maintaining social distancing? Some officers have advised it's okay, and others have said no. Are we able to make a clarification on this?
Okay, so you must be a resident of the Strat itself. You cannot invite any person in. And if you're sitting around the pool and maintaining social distancing, no offence or breach of regulation is committed.
Thank you, Police Commissioner. And for the interest of time, or in the interest of time, I will keep my questions for our next briefing. Thank you.
All righty, we're going to go back to Wendy to wrap up from CNS.
Thank you, Donna. There was one more question that I wanted to ask, which is follows up on what Rashma said about the not testing the people that are going to go on the roads. I was having a quick look today before the briefing. There are very, very, very few retailers in Cayman that can offer any kind of payments either over the phone or online. So if people are going to start delivering, they are going to be interacting with the people that they deliver to make the payment. So are there not real concerns about not testing these drivers?
Well, anytime we open a sector, of course there are risks and concerns, but the view is, and we've looked at what's being done in other places as well, and we've taken public health view on these things, that there's minimal risk involved in this if things are properly done. I mean, I'll give you an example. I woke up this morning and I looked out on my patio, and there was a case of beer. I said, who in this house ordered a case of beer? It turned out it was one of my sons, and they had arranged for it to be delivered and for payment to have been effected, and we didn't even know when it came and when they picked up the money, so it can work.
Yeah, oh, absolutely. I agree with you. Where there are people where you can pay online or you can pay over the phone, but there are loads more where you can't.
But you can also leave a check on the counter of the bar or outside your door, or however you arrange for the payment to be made. You don't necessarily have to interact with the person. Is the point I'm trying to make. We're doing the best we can in the circumstances we can, understanding full well that we've been in lockdown for 5 weeks, that there are things that people need, things that people want, and we're trying to minimize the risk, but not paralyze the place in the meantime. And we can't, we just don't have the facility with all the other testing that we're doing to test, all of these people before we let them back on the road. It'll be another couple of weeks before we'd be able to do that. So you're weighing up the risks and the benefits all the time. It's a very difficult exercise.
Right. Okay, thank you.
Okay, thank you very much to members of the media. I believe the Minister of Health has some final words he'd like to say. No, it's just happy birthday to Joshua, who's 13. He's 13-year-olds. Keep messaging in. And we forgot to mention that Kiabsek, Samuel Rose's birthday is today. Happy birthday to you, Samuel Rose. And to Bobo, who delivered, him and his wife delivered twins last night. Congratulations to you.
Donna, could I just add, just
His
to say,
Excellency,
we're not planning a press conference over the weekend, so we will be back on Monday. And on a lighter note, I'm coming under massive pressure to do another steel pan performance. Unfortunately, as I said last time, I only have 3 tunes. The third one is "Oh Christmas Tree," which I clearly can't do. Right, as it's taken me about 4 months to do each tune. I am working on one, but it will be some way off. Okay. Thank you very much, Your Excellency. I'm sure the public is looking forward to that one. All right, folks, just a reminder to go online to gov.ky/coronavirus and click on the FAQ section for answers to your questions, as well as guidelines on DVDL renewals, and also to eservices.gov.ky to do online business. Thank you to everyone who's made today's press conference possible, as well as throughout this week, to our panel, and of course, you, the public, for joining us. We invite you to join us again here on Monday. We leave you now, for those of you who are watching, the press briefing with a look at today's regional and worldwide statistics.